Hi, welcome everyone to evening seminar, Brain-Based Visual Impairment and AAC Approaches for Success. Our speaker tonight is Melody Zagami Furze. I hope I pronounced that correctly. Jessica was unable to join us tonight, but we do have her information and slides that Melody will present. So very excited to share a little bit about Melody. She is an educational specialist for the Professional Development and Training Team at the Herring Center for Inclusive Education. That's at the University of Washington. She received her doctoral degree in special education from the University of Northern Colorado in 2021 and earned her master's in special education from the University of Massachusetts in Boston. She also consults as part of the Brain-Based Visual Impairment Research and Development Team for the Anchor Center for the Blind in Denver, Colorado. And prior to moving to Washington State, she's worked at many places, the Perkins School for the Blind, the New Mexico School for the Blind, and in several different school districts. Melody's work focuses on learning strategies and techniques for children with sensory impairments. Her expertise is program development for young learners with diverse neurological profiles. She does coaching, consultation, collaboration with early childhood teams and early intervention and preschool supports. She wears a lot of hats, including clinician and researcher, and we are very pleased to have her. Melody, take it away.
Okay, thank you so much. That sounded all very good. I'm actually not a clinician, but I have been a teacher of the visually impaired for about 14 years. And so when you're a teacher of the visually impaired, kind of the most important work that you can do is sort of understanding the clinical sort of profiles of your students with visual impairments, and then putting that together with kind of the educational piece. So that's kind of what teachers of the visually impaired do. They take that medical info and that functional information and kind of put it together to understand how the child accesses their visual environment. So Marcy, thank you so much for the introduction. And as Marcy shared, Jessica unfortunately couldn't be with us tonight. She's my colleague and we worked together for many years in New Mexico. She's an instructional lead therapist and kind of runs the program in our early childhood programs in Albuquerque at the New Mexico School for the Blind. And Jessica has the good fortune and has done the good work of being both an SLP and a teacher of the visually impaired. So she's got those two things coming together to help inform the work that she does with our students. So, before we start right off the bat, I'll let you know that CVI, and you probably know it as cortical visual impairment. We also call it cerebral visual impairment. I'll just call it CVI for the purposes of this, this presentation, but we've got a lot of different names and terms, and I'll get into that a little bit as we go on. But basically, we want you, some of the goals for this are to really understand, have a basic understanding of CVI, what causes it, how does it affect visual functioning and visual development in children, and then related information such as demographics and populations, challenges, and also what are those, what I would refer to as sort of the behaviors that go along with CVI and having it. We also want you to gain knowledge of the communication and language challenges that are associated with CVI. And we want you to learn of some appropriate modifications for your own work and your strategies that you try to implement for your caseloads of children that have CVI. So, and the way that I'm going to frame this too is I'm going to talk to you about both blindness, a total blindness and visual impairment in children, and also CVI. But to understand one, you sort of need to understand the other and what the differences are. And you may already kind of know those things, but I just do want to go over those a little bit because in our field, we've done more work in understanding sort of blindness and low vision in children. There's a lot of research there when it comes to communication, and we don't have as much research in communication when it comes to children with CVI. Just want to kind of give you that as a little heads up. So in order to talk about vision, it's important to understand how vision develops and how important it is for kind of all areas of development. So you can see on this slide here that motivation is a very large part of the function that vision plays for young children, right? We're motivated to learn about the environment around us, to go to toys, to inspect things, to move and to kind of play and learn and explore our environments. It's also very important for social interaction and communication. And it provides information about the environment, the world around us. It aids us in future learning, so the building blocks of reading, literacy, and it's also a key distance sense in that it allows us to understand the world that's outside of ourselves, right, in our environment. Nearly 90% of what's learned in the first 3 years of life is learned through vision. It enables children to recognize their caregivers, right? To know if they're there, motivate them to learn from their caregivers and understand and recognize their faces. And one thing about vision that's interesting is that it's qualitatively different from other senses in that it's constantly active, unless we're asleep, of course, right? But it's always on. So other senses, they usually function intermittently, like taste and smell and even hearing, right? It's kind of something that comes and goes, but vision is always present. And also it allows us to take in a massive amount of information happening eventually simultaneously about our environment, the people around us and our surroundings. It also plays an important role in the development of both the interpersonal self, so me understanding about myself, and the ecological self, right? Me understanding about myself in relation to kind of the rest of the world and the environment. And I'll use the example here of my son. My son is now just turned, he's 5.5 or 5 and 7 months, as he likes to point out. You know, he has spent his life looking at himself in the mirror, and he still does that pretty much every night when it's time to get into pajamas and every morning when it's time to get dressed. So how do I develop that sense of self? And vision is a very, very large part of that. And vision, as you probably already know, as folks who deal with language and communication, is very important in helping children to develop that joint reference, right? Understanding joint attention. And then also understanding emotions in faces and facial expressions as well. So in order to sort of understand what can sort of go awry in development, it's important to understand typical development. And so language development, of course, is not my area of expertise, but I wanted to have a slide that kind of showed us typical vision and typical language development. And the vision side is about 4 months and the language side is about 3 to 6 months here with these particular skills. And what I want you to be thinking while you look at these skills is, how does one inform the other, right? Because as we know, things don't kind of just happen in isolation, right? We can't really look at skills in isolation, or we can't really evaluate them in isolation, because we know that the foundation of one skill can support the beginning of another, right? That kind of a thing. So when we think about these skills in terms of language, it's important to understand that children without vision really must use and organize different perceptual data. So the different sensory experiences that are happening for them in the environment. And they have to use these to arrive at cognitive achievements through alternative developmental routes. So I got that in a great book, and I'll provide you with some resources at the end and references, of course. But when you think about shifting focus, how does shifting focus and the ability to look from one object to the other help you to interact in the social world? How does improved hand-eye coordination help you to develop skills? How does just showing interest, or as we talked about in the last slide, being motivated to move towards things in your world, how does that build on your social skills, right? And how does recognizing faces, that's a huge one. Can a child vocalize excitement and pleasure if they can't see what it is that they're supposed to be getting excited about, if they can't see their mama coming, right, to their crib to get them, right? And blind babies can use their sense of hearing, of course, and that's where that kind of taking alternative developmental routes comes in, right? So it's just always very important to understand that vision. And I will give you the anecdotal experience I have as a teacher of the visually impaired. Usually when it comes to especially small children, actually every kid, and using their vision, people will say things like, oh, I didn't even think about that, or I just never considered it, right? And that's because Again, vision is that constant accessible thing that's always there for us. And that's just not true of all individuals. And so we kind of have to consider vision just right off the bat and be thinking about, well, if this child has a visual disability, what are going to be the barriers to some of these language and communication skills? So I want to talk a little bit about ocular versus brain-based visual impairment. So I have pictures up here of slides on my slide, and I have a little girl with glasses who has CVI, and she has glasses probably because she's nearsighted or farsighted or something. So you're going to have CVI and issues like that. The little boy in the middle has CVI. His eyes appear completely healthy and normal, right? And then there are two girls on the right-hand side of the slide that have white canes that are totally blind or have very low vision. And to be completely blind and what I would say cognitively intact, having no neurological issues whatsoever, is extremely rare. That is an extremely low incidence disability, okay? But neurological visual impairment, you see with your brain, you don't see with your eyes. So if there's some kind of neurological impact, and we'll go over some of the reasons for that, that can happen, things that can happen that cause it, then if you've got something wrong with those sort of the way that your, anomalies of your brain, disorders, premature birth, things of this nature, then there can be a difference in the way that you process visual information, right? So no matter what, across the board for all of these children and individuals, vision, again, in those first 3 years of life is 90% of the way that they learn. But what happens if they don't have vision, but they have the cognition to figure out those other compensatory skills? And then what happens on the other side with children with a brain-based visual impairment that don't have the ability to process the visual information that they're taking in a typical way like you and I do. And in general, the definitions for CVI, and we'll get kind of into that in a minute, is that CVI does not, with CVI, the anterior portion of the eye itself, there's nothing wrong with it. It looks completely normal. So you can have a completely normal looking eyes like this little boy in the middle and look very typical, but it's about the way the brain is processing the information. So it can be a little bit of a hidden impairment almost, or disability. So in terms of definition, now we have a lot of different definitions. And as I said earlier, there's lots of different terms, and I'll talk about that in a second. But in general, it's impaired vision that's due to bilateral dysfunction of the optic radiations or visual cortex, or both. And it can coexist with ocular and ocular motor disorder and can be the result of perinatal brain dysfunction or be caused by trauma. And approximately 30 to 40% of children with visual impairment have CVI. And children with this kind of brain-based visual impairment make up the majority of caseloads of teachers of the visually impaired like myself. So we do have children that have, retinal dystrophies, that have glaucoma, that have cataracts, that have very, very, bad, poor vision, right? But those children are fewer and farther between than our children that have some sort of neurological impact that has caused differences for them. And the visual system is a very complex, and you can think of this sort of all of this language about bilateral dysfunction and the visual cortex and all those sort of terms, that basically these all make up very complex networks that are involved in the processing of the visual information. And CVI is really due to disorders or differences in these areas of the brain. So what exactly is cerebral visual impairment? And I tend to call it brain-based visual impairment. People sometimes call it higher visual functioning deficits. People sometimes call it cortical visual impairment. People sometimes call it neurological visual impairment. We've got many different names, and we haven't quite decided on a term. In Europe, they use cerebral visual impairment. Some use cerebral as kind of a broader term that includes vision issues due to brain damage and more superficial parts of the brain, as well as deeper structures of the brain. And some use cerebral to mean higher level perceptual and processing disorders. And some use cortical. So there's lots of different names in it for it. And I think people are a little bit tired of talking about it and trying to decide on what to do. But the fact of the matter is, in order to sort of get funding and have it identified as a disability and have there be coding for it for medical billing and things of this nature, it's really sort of, we have to kind of come to terms with exactly what it is we're talking about. But it's very complex and people all have a lot of ideas about it. But of course, at the end of the day, what we want to do is be able to serve the students that we have as well as we can and help them. So it probably doesn't matter much for our purposes, but for sort of federal funding and things like that, it's pretty important to kind of have some sort of set term that we use, right? And as I think I said before, the traditional definition really notes that the eyes appear normal. And eyes, when we say normal, we mean there's really nothing, there's no impact or anything wrong with the structure of the eye itself. But that's not to say that children don't have strabismus, which is a misalignment of the eyes. They could have amblyopia, or which we refer to as lazy eye. So they can have these other problems, but the eye itself is intact and there's actually nothing wrong with it. It's more about the ocular motor things where they're moving their eyes or can't control their eye movement. So CVI is not always diagnosed, or it can be misdiagnosed as other disorders. It's extremely complex, of course. And in some places, it's not widely accepted as a problem, unfortunately. And that is, what we know, right, about sort of our healthcare system is that there are places where you can kind of, you can have success at getting better when you need medical care. And there's some places that don't do as good of a job, and folks who perhaps live in rural areas or in, state by state, whatever it is. So we have some places in the country where children don't get diagnosed with CVI. And we have other places in the country where there's an awareness about it and there's systems in place to help support it. So it unfortunately, like some other things, depends on where you live and what your availability of resources is. So CVI also features a number of common characteristics, but a very wide spectrum of behaviors, challenges, and abilities. And when I say behaviors, I'm really talking about visual behaviors. What we look at to understand if a child is acting in a certain way, it tells us what it is maybe that they're having a challenge with, what it is in their visual functioning that perhaps is not working in a typical way, so that we can kind of drill down and say, okay, and if you're at all familiar with the CVI range, you know that there are 9 characteristics involved in that particular assessment tool. And those characteristics, by and large, apply to many children with CVI. And so you can say if a child has this, this, and this, and this, then they most likely are affected with CVI, right? And one of the really interesting things about CVI is that in general, children and individuals with it can get better or they can improve. And we've just kind of started to look at this in the literature and in the research to say, well, what does it actually mean to get better or improve? Well, how do we measure that? And what does it mean? Does it mean quality of life? Does it mean visual functioning? Does it mean they build skills? Like, what exactly are we talking about when we say get better? Do their visual acuities improve? Do their eyes actually get better? Or is it sort of us providing them with, this sort of holistic approach to understanding their vision better? Do we get better at understanding what it is they can do and then kind of building on those skills? Like, do their eyes actually get better? Does their brain get better, right? Are those connections made? So we have all kinds of questions about that. But in general, most people will say to you, yes, they get better. But to be frank, we don't actually know why they get better or what makes it better. And recovery can occur over months to years, but we know, as we know a lot about in just with disabilities in general, that the earlier intervention, the better the outcomes, right? And the degree of recovery cannot always be predicted by the area of the brain that's impacted or anything like that. I've looked at many, many studies, and I can tell you that there's not always association between what's injured and what's get better, like in 10 patients with the same issue, right? So there's a lot of different variables to consider. Unfortunately, recovery doesn't happen for every single child. Some children, such as those with like ongoing seizure disorders, for example, they do not improve. They kind of stay where they are. So who has CVI and why do they have it, and what kind of populations have it? So what's interesting is that The reason why we have more children and we see more children with it is that our science and our hospitals are better at keeping children alive who used to be at risk when they were born premature or with any kind of issues, right? So more and more, we're better able to serve babies that are born very, very premature. And those babies don't get to develop all the things they need to develop in utero. And so developmentally, they've got issues, right? But then they grow and they progress. And then when they come out, into the big world, it's noticed that they have some challenges and issues, right? So, we've got lots of different reasons here that children have CVI that I have listed. Cerebral palsy. It's estimated that half of children with cerebral palsy are impacted with CVI. So if you have a child on your caseload or a client with cerebral palsy, and you notice, any sort of odd visual behaviors or things that you might question, there is kind of a good chance that they probably have CVI. And again, I'm not a clinician, so I don't make diagnoses, but I can tell you based on a certain set of observations and very holistic assessment, that's a child that perhaps child should be referred right to an ophthalmologist. So the really most frequently reported brain pathologies for CVI are damage to the visual cortex and white matter of the brain. And kind of almost all of these things that you're looking at here lead to something within that area and that realm. So if you see white matter, damage of immaturity, or you see periventricular leukomalacia, those are two of the same things on a child's medical history. If you see hydrocephalus, if the child has a shunt, if you see any, brain abnormalities, brain tumors, traumatic brain injuries, unfortunately, we have many children with non-accidental trauma that have CVI. And then we also have a lot here at the Ager Center in Denver. And when I say a lot, I mean, we have about, 26 children with CVI, but it's a small school. We have a number of children now that have a genetic disorder with CVI, seizure disorders as well. And then, also children that have brain bleeds and a lack of oxygen, so anoxic or events or intraventricular hemorrhage, right? And also all of our populations that have sort of developmental delays and children with prematurity who perhaps had, if you see something in the file that says retinopathy of prematurity or ROP, but it's resolved, and so everybody thinks that their vision is fine. Those are the children that we start to see once they start walking that have issues getting around and show us some differences in the way that they process visual information. So there's a whole host of reasons that children can have CVI. And the other thing of interest is that you can have a child with brain imaging that looks completely normal who have CVI, and you can have children with brain imaging that looks completely abnormal that do not have CVI. So I'll get into it here in a little bit, but really the most important thing that we can do is really have a comprehensive medical history background and functional assessments of children to really understand, what's going on. So I like to use these pictures from this study done at the Harvard Center for Neuroplasticity. So they do a lot of work with CVI, and what's nice about it is that it's that marriage I was talking about earlier of this sort of clinical understanding and using brain imaging techniques to understand what's going on actively in the brain, why people are using their vision. And the nice part about this kind of studies that these folks do is that they take the input from practitioners like ourselves, like speech language pathologists, like occupational therapists, and teachers of the visually impaired. And they take our kind of subjective observations of behavior and the way children perform or play in different environments. They take those and then they put that activity to the test and take brain imaging while people are doing different tasks and activities to figure out exactly what's happening in kind of the visual brain while they're performing activities. And it sort of shows, based on a number of research studies that they've done, that our observations and sort of recommendations for how to help children and for strategies and interventions really actually make a lot of sense based on the information that we're getting from these studies. So this was a neuroimaging study that was done, and Participant A is the sighted control. So that's a typical seeing brain, someone that has total vision, does not have any, does not have any visual issues at all, does not have CVI. The middle picture B is an ocular blind person, meaning someone with extremely low vision, who has a very low visual acuity, right? Glasses do not correct for their vision. They cannot see very well at all. And then participant C is the CVI brain. And you can just tell by looking right at it right away that there's something that is going on that's considerably different in the CVI brain than the other brains, right? So, and again, framing this as a disorder of information processing. So when and the study itself actually took these subjects, and it was in a virtual reality environment. And these subjects are, these folks are, they can talk, they can, they can respond, they can communicate with the assessors and with the researchers. And they did a study where they asked them to find a particular person in a crowded hallway. And the hallway starts out pretty simple, and then it gets busier. There's more sensory information. There's loud noises. There's more and more people in the hallway, and there's lockers on the side. It's like a high school hallway. And they were asked to search for a particular person. Okay, so this is showing their brain activity while trying to search for this requested person. So you can see that the sighted control and quite fantastically, the blind person, the same areas of their brain, those same connections are being made as they do perform this visual search task. But for the individual with CVI, it's just clear that that's not all going on, right? There's something that's going awry in the networks and the messaging that the brain is sending to, all of the different places it goes to understand the information. And this sort of has been shown across different activities where somebody is trying to do a visual search. And in all of them, the sighted control and the ocular blind individual are really kind of, their brains look like they're performing the same task. They're doing almost the identical activity in their neurological activity. But in the CVI patient, we see something completely different. So when you work with individuals with CVI, keep these images in mind and just think about those neural networks and sort of how hard they struggle to make sense of visual information. So a way that's sort of a real world application for me to explain CVI to you is a grocery store. Okay, so I use this analogy, and I stole it from Dr. Gordon Dutton, who is an ophthalmologist in Scotland, and CVI is really his main thing, and he's amazing. And I took a course once from him, and the grocery store analogy is like this. Think about your grocery store that you stop at on the way home from work in the evening, and you pick something up for dinner, whatever it might be. And you're used to this grocery store. You've been going to it for years. It's right down the street from your house, right? You know where everything is. You know where things are you're going to get. You know where the cash registers are, etc. Well, one day you go into that grocery store and they've changed the entire layout. So now where the produce was, the bread is, now that's where the bread is. Where the cereal was, now that's all frozen food. Okay. So the layout that you had for how this store was set up and your ability to navigate through it without really thinking about it has completely changed. And think about how frustrating that experience is. And I've had this happen to myself, and that's why I love this analogy, because it's like something that was completely predetermined from you. And I explain it as we kind of have these little files in our brain, and we really need vision to build those little files up to understand the world around us. And when those files are damaged, or they haven't been built in the first place, we don't have them, then there comes to be these differences in this disorder in the processing of the visual information. So in other words, in order to get around this grocery store now, we have to completely map out all of the information again about it. And that takes time, and it can be frustrating. And then we add in all of the noise and the lights and the other sensory information and clutter that's in this environment. And it kind of becomes a confusing place for us to figure things out. So let's talk a little bit in this next slide about sort of the characteristics of CVI, or how it manifests itself in individuals. And you may or may not know some of these terms, but in general, let me go back to my notes here for a second, excuse me. So CVI can affect acuity, right? Our ability to see clearly. It can affect our contrast sensitivities, or our ability to see, something light brown on an orange background, for example, right? It can affect our binocular vision, our visual fields, and also our higher order of visual functions as well. And those higher order visual functionings are things like the ability to recognize objects and faces, or the ability to orient to an environment and sort of navigate it or map it, right? Get around safely, safe movement. So what we see with children with CVI is they have atypical responses to visual stimuli. They don't respond in the same way the normally developing brain responds to vision. They see a toy, they don't necessarily respond to it in a way that a child without CVI does, right? They have poor, inefficient use of their visually guided motor movements. So for example, they don't always touch something and look at it at the same time. You're probably familiar with the visual, what we try to work on is a visually directed reach, but children with CVI don't always have that. They tend to look and look away and then try to manipulate the object. And that's because that information is too much for me to reconcile at the same time with using my hands and using and also looking at the object and taking in the visual information. They show delays in visual response, which is we call latency. So we look for latency. How many seconds does it take for a child to look at this red ball when I hold it up? A child with typical visual development and no neurological impact would just look at the red ball and be like, give me that red ball. And why doesn't our kid with CVI do that? Okay. Difficulty with distance viewing. So in other words, not being able to attend to things in the distance. And I told you earlier that sometimes children with CVI do have refractive errors, or they're nearsighted or they're farsighted. But the difficulty with distance viewing can be a product of being nearsighted. But also the most important thing to understand about children with CVI and recognizing things in the distance is that the farther away you get from things, the more visually complex the space and sort of the environment is, right? So if I put myself really close to my computer screen, I'm blocking out all of the other information and I'm just looking at my slides right now. I frequently have parents tell me, oh my goodness, so-and-so is getting so close to the TV, they may not be able to see well. And what I tell them is, well, that may be true, but really what's going on is that that child is kind of trying to block out other visual information so that they can just focus on the show that they want to look at. Or, you know, I had a little girl on my caseload for the past 2 years who would run up to me and look right at my eyebrows the minute that she got there. And she was confirming that was me. She was getting rid of all that other visual, the visual complexity of the environment to just kind of come up and look at me, right? They have difficulty with new materials or environments. So what we refer to as novelty. They really like things that they're familiar with. And, you know, my own little theory is that that's because they've got a file built up for that thing in that little brain. And they understand that thing, they're comfortable with it, it's not challenging, and they've learned how to look at it in a way that works for them. They also talk about preference or familiarity, and that goes along with novelty too. So we use the term preference a lot, and you'll see here preference for certain visual fields or preferences for colors. Children with CVI, I'm sure you've heard many times, oh, they love red and they love yellow. And it's not about liking, and it's not really about preference. It's more about they can see it, right? So yes, they prefer it, but the reason why they prefer it is because it's what they can see. So what they can access visually are usually the things that they like to play to and that that play with and they're motivated by. They tend to have light gazing, and we're going to get into light a little bit because light can be very complex. Children with CVI can really benefit from techniques that use lighting to elicit kind of visual responses and behaviors and have them look at things. But other children actually can't deal with bright light very well at all, and they'll shut down. I'm working with a little boy right now at the Anchor Center who really doesn't open his eyes at all when the lights in the room are on. And in order for us to really work on his visual skills, we need to have the lights dim so that he can kind of focus on things. And it's interesting because he does close his eyes all the time, and it tells me that he can see the light, and the light bothers him. And when we have light sensitivity in the world of visual impairments, we call it photophobia. So some children can be very photophobic. Sometimes they need light to work, but sometimes environmental lighting is like not very good for them, and they tend to kind of shut down. So we really need to be able to figure that out before we work with them. They have difficulty in busy environments and also with busy materials, right? And basically the busier, kind of the worse, right? I talked about preference for certain visual fields. Again, not necessarily a preference, but more like if I've got it, if I have a neglect or what we might call a field cut on my right side and I can't see, then I'm going to use my left side because that works better. Sometimes they exhibit better visual performance with movement, and sometimes this can go both ways. So sometimes they can see things that move better. Sometimes they need to be moved to see things better. They can have difficulty recognizing, labeling people, places, and objects, and difficulty with spatial relationships and mapping. And again, those are some of those higher functioning visual deficits. So those are the type of things that you see in children, not necessarily with complex and severe disability, but children that have milder CVI. And those children especially can fall through the cracks because they can be mislabeled with attention deficit disorders, autism, things like that, when really what's going on is these differences in processing of visual information. But because perhaps at one point, or they don't have any other, visual issues, that just wasn't considered as part of what their problems could be. So how do you know if a student that you have on your caseload or you work with has CVI if they have no formal diagnosis? Well, as we said before, one of the most important things to do just in the first place is to consider vision as a reason that a child might have challenges with, whatever skills they're trying to build or you're trying to work on. And again, this is very difficult because vision is just not something that we're consciously aware of, because we kind of all have it and it allows us access to everything. And we never really have to think about all of the complexities of the way that it works, right? But that's definitely the most important thing, to just even be aware and thinking about it and raise awareness about it. We can tell in the first few months of the first month of life, early signs can be reduced visual acuity, reduced visual fields, and the malfunctioning of basic visual functions. And my team and I at Anchor Center work with a screening tool called a NAVIG. And as you might be aware, we don't have any screening tool for vision in the NICU and in hospitals when babies are born, but we do have a hearing screening. And so what we're trying to do is work towards getting a vision screening so that we can raise awareness, because children have demonstrated time and time again that their visual skills, they actually have much more readily available visual skills in that first month of life than we thought that they did. So that's good news. So that helps us, right? So what are these? We look for red flags, or do they already have those diagnosed conditions? Were they born with a brain bleed? Were they born at 25 or 26 weeks? Did they have a lack of oxygen? Do they have some sort of neurological abnormalities, right? What are their challenges and abilities? And I talked to you a little bit about behaviors and how they're, oh, I see a chat. Shall I look, or shall we save it?
We can save it till the end.
Okay. All right. We'll do it. Thank you. Do they have glasses? If they have glasses and they have multiple impairments, it's like, why do they have glasses? Do you know the reason? What is that? What are those glasses for, and what are they helping with? What about their ability to attend? Can they sustain and maintain visual attention to task or to what you're wanting them to do, to pictures? We're going to talk a lot about pictures in a few minutes. Movement. Do they tend to move a lot around themselves, or do they tend to pay attention to things better if it moves, right? And then what do children with CVI need? Well, they need an ophthalmologist or at least an optometrist to get them started. And some people would say, oh, glasses aren't really a big deal. Well, I'm going to tell you that glasses are a huge deal, because many of the children that I see who have glasses and don't wear them regularly, if you or I had the vision that they have, you would wear your glasses, because otherwise you would not be able to see clearly. And especially in the developing brain, it's very important that we be able to see the details and we see things clearly so that we can build on those visual skills and build up those visual files, right? So we really need to get a handle on, does the child need glasses? Does the child have some kind of ocular motor issues that perhaps could be corrected with surgery? So we have very good success at correcting strabismus and other sort of ocular motor disorders with surgery, and that helps to align the child's eyes so that they can focus and look, okay? Also doing holistic evaluations. So I know that we know about this in the world of special education, right? But really understanding the clinical side, the imaging side, looking at all of the evaluations that we really can do to get as much information as possible about that child and their abilities and their challenges, right? And then we really need someone on the team with an expertise in visual impairment, and more desirably CVI, right? We need someone who can understand these things. And I've worked with many practitioners that are not teachers of the visually impaired that have a very good handle on CVI. And I've worked with many teachers of the visually impaired that don't have a good handle on CVI. So we're kind of all over the place. And of course, we're always working towards including CVI in our programs and helping our practitioners to get the information that they need. And one of the reasons why I pursued sort of going, moving towards understanding how to do research and policy development and things like that in my field is because I know that the information that comes from the research does not always trickle down to the practice of practitioners. And so how can I, introduce a group of people to CVI and help to explain it to them in an accessible way so they can be aware of it and go forth and try some strategies to help as interventionists, right? And then it's also very important to understand the barriers of sensory impairment. So I've talked to you a little bit about visual development, right? So if I don't have that vision, or if I don't have hearing, if I have a sensory impairment that doesn't, and even autism really, that doesn't, allow me to sort of perceive the world in a typical way, what are the barriers to my learning because of that impairment? Okay, so let's get a little bit into visual impairment and communication. So this slide represents a study that was done by some folks in Italy, and they studied they had studied cognitively blind children. And hold on one second, I just want to go. Yep, okay. So they studied cognitively, excuse me, yeah, they studied congenitally blind children and who were totally blind but cognitively intact. And they also studied children with CVI. So, and the visually impaired children who were blind but didn't have any other issues, right? Them in regards to their communication development, they were delayed during that sensory motor development period, but they eventually caught up once they started getting the hang of language and understanding they could be used as sort of a compensatory skill to learn more about their world. So, hearing a toy and then eventually wanting to move towards it. So really using, and again, talking about that just different developmental trajectory of reaching a skill, but just doing it in kind of a different way, right? They also have delayed object permanence, and object permanence, of course, is one of those very first and very important early developmental skills. They have delayed symbolic play, which when you think about not having vision probably makes a lot of sense. They have also that delayed development of self-representation, right? Not really understanding that sort of that self piece, right? They, of course, have barriers to eye contact and reciprocal gazing with their with their mothers, with their caregiver dyads, right? And they also have barriers for interactive routines. And one of my colleagues in Washington State, who's an early interventionist and has been for a very long time, has this wonderful presentation that she does. And in it, she talks about how, the blind baby, when the mom walks into the room, they're completely silent in their crib. And the mother can think about this and kind of internalizes it as, oh my goodness, like, why isn't my baby happy to see me, right? But what the baby is doing is the baby is listening. The baby is listening for the mother. So when we think about those differences and just the way that these children kind of respond to their environment, we can understand how some of these delays happen, right? And then if that happens and the caregiver thinks that the child's not interested in them, what are the effects of that, right? With that sort of partnership and that reciprocal communication piece that goes on in language development. So in brain-based visual impairment and communication, this Italian group led by a lady named Elaine Fazzi, learned something though about children with the CVI, with the brain-based visual impairments and the communication. So they serve that they say, they state that vision really serves to organize and integrate all of the incoming information from all of the senses, right? It's kind of what orients us to the environment. So children with brain-based visual impairment, in their communication, their early communication, they really use their hands for self-stimulation instead of reaching out. So keeping closer to that internal self in the body, as opposed to going out into the world, right? And being motivated to move, right? Keeping in that safe space. They really achieved or delayed inability to reach an object presented through sound. So using that as a compensatory skill. And they find it difficult to separate themselves from the environmental points of reference or contact. So for example, staying in the chair, staying next to the table, staying wherever it was that they felt safe. And when a child's visual impairment is associated with other impairments, the capacity to explore their surroundings is profoundly limited. So just off the cuff, by having that cognitive impairment and that visual impairment, you're limited in the way in your ability to explore the world around you, right? So what are some approaches for success? So, this is kind of the exciting part, right? Like, how do we manage CVI, and then how do we help children? Excuse me. We've got proper management of CVI, which requires holistic, multidisciplinary assessment and habilitation. So everyone on the team assessing and understanding what the child needs and where they can go. Because as a teacher of the visually impaired who has worked with physical therapists and occupational therapists and speech and language pathologists and developmental specialists and teachers, I can tell you that you're going to inform the work that I do, and I'm going to inform the work that you do. So in early intervention, the physical therapist wants the child to be in tummy time. I want to give the child visually motivating materials so that the child will be motivated to pick its head up and start building on that next strength, right? So all of the work that we do, just like the developmental, just like, you know, the way that we develop, all of it works in synchronization with each other, right? And happens in multiple ways and on multiple fronts. So being mindful, that really is the key to successfully intervening for children with CVI. And I've seen that time and time again. And when we do things as a one-off, or we don't communicate with each other, we don't collaborate, then we're really losing the ability and the opportunity to serve the child as holistically as possible, which is really what needs to be done. So the key elements to really promoting habilitation, and habilitation is the term that's used in our field because it's not rehabilitation, because you're not getting anything back. You're trying to, you're trying to support and promote skills that have not been there, that are not there in the first place, right? So we call it habilitation. So the key elements to that are really promoting visual development, and then adapting the materials and the environment to meet the child's needs. So a lot of the work that I do with adults and teaching children with CVI is actually adapting the adults' behavior and what the adults are doing and how the adults are presenting information, and really has kind of little to do with the sort of what the child is doing externally, but it's more about kind of coaching and teaching the grownups. And you do a lot of that as speech language pathologists as well, right?
Melody,
So
I'm going to interrupt you for a second.
sure.
Because you asked me to. We have about 14 minutes left until the top of the hour.
All right.
And so I'll let's plan to finish up on the hour. And then if those who want to stay for questions after, does that work for you, Melody?
Yes, absolutely. Yep. Perfect.
Okay.
Thanks.
Thank you.
Yeah, sure. Yeah, we just got a little bit more. That's kind of the hard part. So this is sort of the fun part. So, what I've kind of done is talk to you about CVI, just understanding CVI, knowing a little bit more about it, knowing who has it, knowing why it happens. And now we're going to look a little bit at strategies for learning, and then modifications we can make to your AAC devices and your interventions. So strategies for learning for children with CVI are really about access to familiar and repetitive activities, right? So starting sessions, for example, with a song and using the same song every time, really using those same routines, matching activities to the child's visual needs, right? So what kind of colors work for the children? What kind of space modifications need to be made? So routines to locate spaces and activities. You look at this picture taken from our school in New Mexico. We've got real photographs of the items that are in those boxes, and they're all clearly labeled. And there's a bit of visual clutter there. So one other thing I might do would be, if I wanted a child to make a choice between, the bottom 4 bins, I might cover up the top set of bins with a black cloth so that they only have those available, or vice versa, or something like that. But it's just kind of a way to be organized, right? Providing a beginning, a middle, and an end, and providing activities in short durations until the child can have success with it and is comfortable with it. And when we talk about routines to locate spaces and activities, that can either be like, for children with CVI, it can be difficult to get around without using kind of sensory landmarks and cues. So when they're walking from the classroom, to your speech therapy, to your office, what are some sensory cues that they can, tactile cues, auditory cues that they can use to navigate through the space to where they're going, and using that same routine consistently every time to do so. Using familiar materials and using adapted materials, and using familiar materials, and then slowly building in more different things that might be a little more challenging, but having a starting place that that they're comfortable with, And then verbal and tactile cues that can be associated with language concepts. So we know that things like more can be very abstract and might not be available to students, and more tends to be one that people really love, which I get. But what kind of verbal or tactile cue could be used to help to teach that concept, right? So I want to talk to you a little bit in this piece about pictures, because what's come up for me as a teacher of the visually impaired is that when I work with folks in the school district, they kind of have this preconceived notion that and I am not singling out just speech language pathologists. This actually happens with vision teachers quite a bit as well. You cannot assume that because a child has vision, they can see pictures. And sometimes they can, but a lot of times they cannot understand pictures in 2 dimensions, okay? And this is a study, and I talked a little bit about how the folks at Harvard Center for Neuroplasticity kind of take our work and then try to really show what's going on when it comes to people with CVI and kind of how things, how they can sort of neurologically, figure out what they're looking at and what their brain does while they're doing it, right? So in this study, we have something called a hierarchy of picture representation, right? Where we go from real photographs to more abstract photos. And you can see across the board here, these little kitties. The kitty on the right is a colored photo of a real kitten. And the kitten all the way to the left is more, and the cat on the left is a more abstract outline, right? So, and this is a little squish, I apologize, but there's an abstract outline. There's a realistic outline, which looks more like a real cat. There's an abstract color cat. There's a realistic color cat, and then there's the photo of the cat itself, okay? And you can see that, let's see, that the controls in blue usually could do a much better job of recognizing those more abstract pictures than the children with, than the individuals with CVI. So this is just one of those things that shows us that pictures, and the more abstract they are, kind of the worse. And if you think about the tools that we use for like PECs, and the images that we use for children with disabilities, we show them a lot of pictures that perhaps don't make a lot of sense, or at least don't connect them to their world. And if you think about this in terms of what I've told you about kind of building those visual files, well, how do I know a cartoon cat is a cat if I don't have a lot of experience looking at a real cat? And that's kind of what this comes down to. And there on the right, you see something that says an ROC score, and I forget what that acronym stands for, but that shows the agreement between the gaze patterns of looking at the salient features of the pictures, okay? So the salient pictures of the features are the things that they're looking at, that they're going to time and time again to understand what the animal is. And this one is a little bit interesting because in the individual with CVI, they actually went to that realistic color. And, to my mind, one of the reasons might be it stands out a little bit better. It's a little brighter and it still looks like a real cat, but it's kind of like a bright and bold real cat, right? So this is just kind of an interesting study that shows a little bit, and they're kind of working on this, about the way that folks with CVI kind of perceive more abstract pictures. So if we think a little bit about faces and kind of social interaction when it comes to CVI, some of the problems just in regard to the way that individuals with CVI respond to faces is they can't recognize faces or facial expressions. They can't recognize faces out of context. They can't follow fast moving facial expressions, and they can't look at a face and listen at the same time. And I haven't talked about that piece a lot, but that piece involves 2 things. It involves perhaps auditory processing, where I can't look and listen at the same time, and especially with something as visually complex as your face. But sometimes people with CVI, they can't see more than one thing at a time. It's just not available to them. And children with CVI sometimes will, depending on like kind of the extent of CVI that they have, will look right at your forehead and sort of where your hairline meets your head, or they'll pick you out by your hair and your hairstyle. And one of my recommendations to teachers and practitioners who work with children with CVI is like, if you're going to change your hairstyle, you have to sort of either explain it to the child or help them to understand it's you by using your voice. Because a lot of times they're using your voice, or they're using what we would call salient feature of your face, the way that you dress, something like that. Another important thing to remember is to really wear very muted colors and not a lot of crazy bold patterns or complex patterns, because that too is distracting for them, and that makes it difficult for them to attend to whatever it is that you're doing visually. So just some things to consider about social interactions, right, and CVI. Okay, so this is the part where we talk about sort of, well, what is it that you can do to help sort of, help your interactions, help your practice with your children with CVI, right? So you have to consider the that seeing does not mean recognizing. And I think I stated this last time, just because I have vision does not mean that I can understand what I'm looking at, okay? So you have to consider the level of representation that you're providing to the child. Two-dimensional versus three-dimensional. So if you want the child to make a choice at snack time, are you going to provide them with the actual bag of goldfish crackers and an actual Oreo and, a bag of Oreo cookies? Or are you going to provide them with pictures of that or abstract pictures of that? Because that might not be something that they can access. And again, what I would stress is that in our field, we've spent a lot of time, and some of this is sort of just a product of the way that we assess kids, and the way that we think about it, like we're building on vision, we're making their vision better. But to be frank, vision is just not always available. And if you can't do that, if they don't have the vision that they need to do these tasks and gain these skills, then you have to take a couple of steps back and really work with the teacher of the visually impaired to understand, well, how is it that they access sensory information? Is it auditory? Is it tactile? Is it a combination of both? Do they need tactile first and then they can bring their vision along, which is which happens very often for children with CVI. So these are things to think about. And as we just talked, that kind of concrete versus abstract, just sort of, that foundational knowledge about what is it that I'm looking at? Is that available to me? Do I understand a cartoon picture of a cat is the same as an actual cat? Are they able to recognize the cup in a variety of presentations? So if you start very simply, can you eventually build it up? But can they generalize? Can they kind of visually generalize their skills to understand the cup, right? Or can they only recognize their own cup? Or do they recognize it as an actual cup? How do you know that? It could just be that they know the color and they know that they're going to get, their juice in it or whatever it is, right? So we really need to be working to consider what their preferred learning channel is. And it's really the job of the teacher of the visually impaired to inform the team about what that is, what that learning channel is and how to build skills in that area. So contrast, as we said before, we've got some images, but contrast is that ability to see something on a background, right? So children with CVI can have reduced contrast sensitivity, and frequently children with CVI have what's called optic nerve atrophy. So that's where the optic nerve is just not as healthy and robust as it is in somebody with typical vision. And so the signal then is dulled or muted. And if the signal is dulled or muted and they have an optic atrophy, or you see that in the paperwork, then you want to be sure that you understand what kind of contrast they can see. And there are tests that can be done to do that. You can put a same colored, you can put a red block on a red piece of paper and see if they can look and grab it, or look away and grab it at least. Do they notice that it's there? And this is actually a pretty easy test to do. Do they respond to things that are high contrast? And if you think about babies and baby vision, I frequently tell this to people that having severe CVI is like having baby vision. So I can see things that are high contrast because that's how, when vision first develops, those are the things that we can see so that we can understand how to be fed and we can start to understand the world around us. So reduced contrast sensitivity can really have an impact on how we see, and it can cause the image to appear faded out or really not there at all. It's possible to have perfect visual acuity, but also to have low contrast sensitivity. And that's something that's kind of a paradox, but that's something that needs to be tested. So you really always need to consider the background on which the things you're working with are put, right? So for visually directed reach, we've talked about this a little bit, but challenges with visually directed reach may really impact your devices and the way that you use them. So, can they reach and touch a switch to access the voice output? And can they do that skill simultaneously? So you need to kind of consider, like, where are you placing the switch? What kind of motor planning do they have to be able to do it? Consider increasing the spacing or using alternate access, right, to those speech generating devices. And you can adapt switch placement to kind of compensate. So using strategies such as light or reflection, so spotlighting, placing the light on the switch itself to attract the child's visual attention, or consider placing the switch where it can be easily accessed without the need for a visually directed reach. And sometimes we can do that by placing, if a child doesn't have the motor control, by placing it by their head or by their feet. But just be mindful that the way that children with multiple and complex needs, they sit in their wheelchairs. Frequently, children with multiple and complex needs who have CVI do not have their lower visual fields intact. So in other words, you can't always put something on a tray like a switch and be secure in the knowledge that the child can access that information visually. You really need to bring it up into those higher visual fields, because for whatever reason, those sometimes tend to be conserved when there's neurological impact. You need to understand where the child sees best and present the information there. And then if they can exhibit a visually directed reach, can you put it on the right side, on the left side, above midline? Where can you put it so that they can interact with it? And that's the type of thing you have to play around with. And can they do it when they're seated, or are they better perhaps at doing it when they're lying down? So visual clutter is a huge issue for AAC and adapting for CVI, right? So children with visual clutter really have a problem finding objects unless they're presented on a high contrast background. So you can see the differences here in these two pictures, where the child on the top has got two real photographs of circle time choices for music, and he's able to kind of look, and that it's placed, and again, what I just kind of told you about placing things sort of up in front of that visual field, it's placed up in front of him. And the woman on the bottom has some more abstract PEX cards, and those are placed on a clear background, and you can see all the visual clutter that's going on in that classroom at this time, or where she's trying to show the child, right? So that's just not available, the child, that does not make sense to that CVI brain. So, and clutter in speech generating devices, this is also an issue, right? So in my experience working with my tech department in my school district that I last worked at, I was told that it was mandatory for the child to have X amount of visual choices on their communication device. Well, unfortunately, this amount, it was a large amount of visual choices on their communication device, does not work for them because they cannot make sense of them. And this is a very difficult thing. I've had a very difficult time advocating for this, because I've been told that it's like, it needs to be done, and it's like a human rights issue. And I understand that children need the access to all the communication that they can have, but what good is that access if that they cannot make sense of it cognitively, right? So clutter also can impact this array size on a communication device. And if you've got a child who has a communication device that looks like this one on the top right, and they can use it efficiently, then if they do have CVI, they certainly have higher level of CVI, and they've got a lot of good functional vision skills, because that's a lot of information, right? You might need to consider more spacing between the images. You might need to fix the contrast. You might reduce the array size, right? Or use alternative scanning methods such as a switch or auditory, right? To kind of show one at a time. And I know this is sort of in contrast to a lot of the stuff that we use, but these things are important to keep in mind, because they really do make it easier for the child. And I've had children on my caseload who can start with one image, and then they just work their way up, but they really need to build familiarity with it. And when in doubt, if you think a child is really able to understand what they see, that's great. But if you're not sure, or you're not getting consistent feedback, or they're not making progress, then you might want to really consider using real images, because those are, well, starting with objects actually, but then moving to real images. It just depends on the severity of the child and what you kind of think that it is that they can actually, process. So we also need to understand, and this is helpful with our teachers of the visually impaired, these are just ideas, and you really need to kind of communicate with your team about this. But do you need to use that slant board to raise materials? Do you need to position the array on their right side or their left side? Perhaps they don't have central vision. This is all knowledge you kind of need to know. And then, is it sometimes appropriate to, we tend to present things vertically, because that's the way that we read and kind of our usual way of doing things. But sometimes children really have better access to a horizontal presentation, because perhaps their left or their right field is impacted, and they just don't know to go to that area and be able to use it. So light is also an adaptation that we use quite a lot. And I can tell you across the board that the children that need spotlighting for things really need spotlighting for things, and it makes a giant difference in their ability to attend to visual information. So what happens is they don't really, you can't learn if you're not paying attention, right? And so if you can't attract their gaze to objects or pictures or things that you want them to learn from, then they're really not going to be getting much out of the activity. And so spotlighting works really well, and it works for books, and it works for pictures, and it works for toys, and it works for choice making, and really having that dimly lit room so that there's not a lot of other visual information for them to deal with, and just really focusing on the activity at hand is a great strategy. Now, what I tell people about this is that the world is not going to be adapted for them everywhere that we go. And so there are things that they're going to have to deal with visually, like complexity and clutter. But it's important to understand, does it upset them? Are there things that we can do to help them to kind of make it through their day sensory wise? And then when you're working on specific skills, are there adaptations like this that you can make to kind of help them to better make project, right? And shifting that spotlight between the objects rather than shining on all at the same time can help to facilitate that shift of gaze and really encourage viewing the entire array of information that you're getting, because basically you're highlighting it for them one at a time. And think about how organizing it is for you to highlight a paper you're reading or notes that you want to take or something that you want to go back to, right? It's organizing, and it helps you to visually recognize it so that it stands out. So here we are. So, all of this is of course done in response and as a way to address the challenges and the skills that the child has when you're doing that multidisciplinary assessment. And it's really key that everybody really know what's going on with the child and with their vision. And I've said it before, and I'll say it another time, but always consider vision when the child is having challenges. And it might not be vision, but it's just important to keep in mind that there might be issues if you see, if you see some of these problems here that we've laid out tonight. And the more severe the CVI, the more likely it is that the child will need really alternatives to visual media. So, the more severe the child has, the more behaviors and characteristics we see, then the more likely it is that their vision is not available to them, or it's only available to start for very, very simple materials and things to view. But really, we need to be focusing on those alternate sensory modalities, such as auditory and tactile communication. The teacher of the students of the visually impaired, they're responsible for teaching the team about the child's visual abilities. And the balance, you really need to balance the need for vocabulary and spacing, and use while following the visual recommendations for the students' abilities and what they can see and how they can best learn. So that is the end of that. Okay, I'll stop sharing, yeah?
Yeah, that sounds great. Thank you.
Yeah.
Thank you so much, Melody, for your time and attention and amazing presentation. I learned
thank you.